Hi, I'm Elizabeth Hallgren, and
I'm Dr. John Hallgren, coming to you live from Mission Direct Primary Care World Headquarters in Omaha, Nebraska.
we are a family medicine clinic that operates on the membership model. As many of you know, we do not bill or take insurance, so your monthly membership fee is what you pay for all of your healthcare, primary care with us. We have just wrapped up a bunch of information sessions, question and answer sessions. We did kind of a road show with how to understand your healthcare options and finances, both with a couple live events and an online event. So what we wanted to come to you today for was just to real quickly wrap up what we was a couple of the key questions we had that came up more than once, and share those answers with you, and just continue to be a resource as you search for your healthcare options, and try and become an informed healthcare consumer, because it's really one of our main goals is to increase the number of people who understand how the dollars of healthcare work, and to really promote price transparency.
Yep.
So. And
figure out how to best situate yourself for Facebook Live.
Yeah. Well, that's one of our goals too, is how not to look crazy on Facebook Live. So, Dr. Hallgren.
Yes, ma'am.
Are you ready?
I'm ready.
For the lightning round?
Ready for the lightning round.
So our monthly membership fee is very transparent. $99 for the first adult, $79 for the second adult in the family, $39 per kid, $49 if you have a fledgling adult still under your financial house, and so that would be $20 to $26. Are there any discounts available?
Yeah, sure enough. So first of all, I'm a veteran, and if you're a veteran, we offer a 10% discount on the monthly fee. If you are in a position where you can sign up for the full year at a time, then we offer a 10% discount and also waive the enrollment fee for that. So in terms of individuals, that's the discounts we offer.
Yep, annual discount of 10% and waive the enrollment fee, and for veterans, 10% discount.
Yep.
Okay.
Correct.
How about HSAs? We got a lot of questions about HSAs and how we interact with those. What's your thoughts?
HSAs are one of the frustrating elements for a lot of reasons, but particularly with direct primary care. People often ask, can you use your HSA funds to pay for your primary care membership? The short answer is no. The IRS, we think, incorrectly interprets the ACA law and qualifies as an additional healthcare plan, and basically, no, you can't use your HSA funds. I also personally think that HSA funds, if you have them, are not the best use of or the best way to pay for your Mission Direct Primary Care. We're a predictable, affordable membership cost. And I think it's better to just pay for that out of your your regular personal finances, and keep the HSA for something unexpected that's expensive.
Yeah, and it'll help you have kind of that war chest aside for when you need to pay either for your deductible to pay for a large, catastrophic event, or if you have a diagnosis and you need imaging, expensive labs, specialist visits, to have those tax deferred dollars is a really powerful tool.
Right. And some people's employers fund their HSA yearly. So in that case, it might make financial sense to use it to pay for a Mission Direct Primary Care membership. The promising news is that there are bills both in the Senate and the House to fix that issue, and hopefully we'll see those move through and just make it a non-issue going forward.
So if you want to talk more about HSAs, give us a call, and we can certainly talk about that.
Or call our senators and your congressman and say, hey, we want this to go through.
That would be the second best choice. And so one of the other questions we got frequently were, if they have a membership with us, do they really need insurance?
Yes, you do need insurance. We are the solution for the predictable, relatively predictable, and affordable elements of your healthcare, but there are the unpredictable and expensive elements of healthcare, like you get hit by the proverbial bus or you get cancer. We don't take care of those things in our clinic, and you're going to need to go to the hospital or have a prolonged treatment course. So yes, you need a financial risk mitigation tool, either traditional insurance, some of the less traditional insurance products, or a health share, to make sure that those things are covered.
Yep. And we talk about those quite a lot. So check out our if you want some options, because we're really focused on education over there about what some alternatives are.
And there are lots of alternatives out there. I mean, there are things that are pretty reasonable at least.
And if you're looking to have a conversation with an insurance pro about these things, we don't sell insurance, obviously, but I do feel comfortable making some referrals. So give me a call and I can refer some good people your way.
Yep. There are people out there who will help you.
Yeah, and who have their mind and business in the right direction to really be consumer friendly.
Yep. Serving their customers in a genuine way. Well, seriously.
I know. You just cracked me up.
What's next?
After hours. What happens after hours with mission driven?
I go home.
And then what happens?
So if you're having issues after hours, we do, one of our big things is we offer 24/7 access to medical advice through us. The clinic is closed on nights and weekends, but you can always get in touch with us. Lots of stuff can be taken care of virtually, and we offer that same virtual service during hours too. If you just want to call us on the phone or do a video chat during regular hours, you can do that.
And it works that access works really well if you're traveling, if you're on vacation or travel quite a bit for your job. That having that access where you don't have to try and navigate an urgent care or find a provider in a strange city.
Had that thing just this weekend. Patient was out traveling out of state and had an issue come up. They called us. We were able to take care of it over the phone, got their prescriptions right there when they needed it, and no big deal. And it was all included in their membership.
Yep. Specialist visits. This is our final question.
Final question. So specialist visits are a thing for sure. We really work hard. If you're going to be paying cash, we work hard to partner with specialists who are cash pay friendly. They're cognizant that that's a benefit to them because it's a lower administrative burden, and that serving their patients. I mean, there are lots of folks who really would prefer to do things this way. So we work hard to find those guys, and we are having some success and continuing to have some more success as time goes on.
And also talk about the thing that I think in a fee-for-service practice, frequently specialist visits are referred as much as a time management tool as they are a need-based tool. And here, you really work to make sure that when they do go see the specialist, that you have done the pre-work and teed them up to have a really productive visit. That really maximizes their value for that specialist visit.
Correct. Yeah, several elements to that. The way we structure our practice gives me the time and flexibility to really practice to my full scope of care, meaning I'm going to be able to manage the large majority of what you might have going on. In those cases where I can't, though, again, that time allows me to really have maximized the workup. So when you go see that specialist, they're not going to be duplicating unnecessary tests. They're going to have a very specific question to be answering for you, so you're going to get more value out of that referral than often most people do. Yeah.
And then, like you said, you really do have the time to practice to your full scope.
Yeah.
So a lot of things people get referred out to. My favorite example is getting moles removed. A lot of times out of a traditional fee-for-service family practice clinic, you'll get referred out for that to a dermatologist. And but they're simple office procedures which you're trained to do.
Yep.
And you can do that here, and it's included in your membership.
Yep, exactly. And if it's something where we need to do a biopsy, we'll send that off. That's not included in membership, but you're going to know exactly what that price is before we send it out. So again, affordable and predictable here.
Yep. So thank you for all of your support in our first 6 months of practice. It's kind of crazy how fast it's gone.
Yep.
These are just some of the questions we got. If you have any of your own questions, please leave them in the comments or give us a call, 402-509-8964. And we'd love to talk to you about it. Like I said, we are just really trying to build better consumers of healthcare here and help people and provide a service where people can access excellent primary care at affordable, predictable pricing.
Yep.
So,
hey, Justin, if you're still on, tell Heidi we said hey.
So, thank you for your time. And like I said, any questions you have, please just leave them in the comments and we will get back to you.
Yep. Thanks.
Thanks.
Have a great Christmas.
Merry
and
Christmas.
New Year's.
And all of the holidays that are being celebrated.
Yes.
All right. Bye-bye.
Good.